Have you ever been sleeping peacefully when suddenly a powerful pain shoots through your calf? Your leg becomes hard, tight, and almost impossible to move. You wake up confused, trying to stretch the muscle while wondering, why is this happening to me? If you regularly experience painful leg cramps while sleeping, don't ignore this video. Welcome to Health Pulse. I'm Dr. Ethan, and today we're going to explain why nighttime leg cramps happen, what may trigger them, and what you can do to reduce them. Nighttime leg cramps are sudden, involuntary muscle contractions. They commonly affect the calf, foot, or thigh, and can last anywhere from a few seconds to several minutes. One of the most common triggers is muscle fatigue. If you spend the day walking, exercising, standing for long hours, climbing stairs, or doing more physical activity than usual, your muscles may become tired. Later, when you are sleeping, that tired muscle may suddenly contract. But cramps aren't only caused by exercise. Sitting for long periods can also contribute. If you spend hours sitting at a desk, driving, or watching television without moving your legs, your muscles can become stiff and tight. Another factor is hydration. When you lose a lot of fluid through sweating or simply don't drink enough throughout the day, your body can become more vulnerable to muscle problems. However, don't assume that every cramp means you need to drink huge amounts of water. Your body needs a proper balance of fluids and electrolytes, including minerals such as potassium, calcium, magnesium, and sodium. But taking supplements randomly isn't the answer either. If you frequently experience cramps, it's better to look at your overall diet and discuss persistent symptoms with a healthcare professional. Your sleeping position may also play a role. While sleeping, your feet may naturally point downward. This keeps the calf muscles in a shortened position, and in some people, may make cramping more likely. So what should you do when a cramp suddenly wakes you up? First, stay calm. Slowly straighten your leg and gently pull your toes upward toward your face. Don't force the stretch. You can also gently massage the affected muscle until it begins to relax. After the cramp disappears, the muscle may remain sore for a while, so give it time to recover. And here's something important. If your cramps happen regularly, don't only focus on what to do when the pain starts. Focus on prevention. Gentle calf stretching before bed may help. Try to stay active during the day, avoid sitting in one position for hours, and increase exercise gradually instead of suddenly pushing your muscles too hard. If you're experiencing leg cramps while sleeping frequently, there may be more to consider than simple muscle fatigue. Sometimes recurring cramps can be associated with medications, nerve problems, circulation issues, or other underlying conditions. For example, if your cramps are accompanied by numbness, tingling, burning sensations, or weakness, it's important to talk with a healthcare professional. The same applies if you notice unusual swelling, skin color changes, persistent pain, or difficulty walking. These symptoms shouldn't simply be dismissed as ordinary nighttime cramps. Another thing to consider is your daily routine. If you exercise intensely, increase your workouts gradually. If you sit for long periods, get up regularly and move your legs. If you spend time in hot weather or sweat heavily, make sure you're replacing fluids appropriately. And before bed, spend a few minutes gently stretching your calves and moving your ankles. You should also pay attention to patterns. Do your cramps happen after exercise? After a long day of standing? After you've been sitting for hours? Or do they happen almost every night? Keeping track of these patterns can help you understand possible triggers and can also give your doctor useful information. Now, there's one important warning sign you should remember. A normal muscle cramp usually comes suddenly and gradually improves. But if one leg becomes significantly swollen, warm, red, or persistently painful, don't assume it's just a cramp. Get medical attention promptly. And if leg symptoms occur with sudden chest pain, difficulty breathing, fainting, or another severe symptom, seek emergency medical care. For most people, occasional nighttime cramps are temporary and manageable. The key is to take care of your muscles throughout the day, not just when the cramp happens. So remember, stay appropriately hydrated, move regularly, stretch gently, increase exercise gradually, eat a balanced diet. And if cramps become frequent, severe, or are affecting your sleep, talk to a healthcare professional. Your body often gives you signals before you realize something needs attention. So don't simply accept painful nighttime cramps as something you have to live with. Take the right steps, pay attention to your symptoms, and give your body the care it needs. This is Dr. Ethan, and you've been watching Health Pulse. Stay healthy, stay informed, and I'll see you in the next video.